If your sights are set on the new year and a resolution for better physical health, yep, I mean the gym, don't let foot pain get in your way. Before you plan to step on that treadmill, take a few moments to learn how an active lifestyle can impact your feet. Earlier this year, the specialists at Tri-County Foot and Ankle talked to us about some of the more common foot complaints they see in their practice.
If anything hurts in your body, the body is telling you that something is wrong. It's a warning sign. It doesn't necessarily mean that it's something extremely severe, but something isn't right.
One of the most common injuries we see in the office is plantar fasciitis. It's basically an overuse injury where the ligament on the bottom is basically inflamed.
It's probably one of the #1 conditions that we see in adults. It is absolutely incredible how many people have it. There's a big ligament in the foot, on the bottom of the foot, that runs from the heel bone up through the arch to the toes. Due to the way a person walks, whether their foot flattens out too much when they walk or they have too high an arch, it causes an excessive pull on this ligament where it attaches at the heel bone. After a period of time, it can cause inflammation. Inflammation causes soreness, and when it starts to hurt, people come to the doctor. We do several things. After examining them, we take x-rays, because very often, because of the tugging and pulling of this tight ligament on the heel bone, it can irritate the heel bone, and often we see something that people hear about all the time, and it's called a heel spur. And that kind of goes along with the package. We try to reduce the inflammation, which is what causes the pain. We try doing oral medication. Often we do injectable medication. So we were able to calm it down, but you don't want it to stay, and you don't want to go through this again. So other things that we do physical therapy for it, where we stretch out and teach the patients how to stretch after they finish the physical therapy to try to keep the condition from coming back. We often make something for them called an orthotic, which repositions their foot, has them walk appropriately, and takes the pull off of that ligament on the bottom of the foot where it attaches to the heel.
Custom orthotics will definitely help support it, and if we can give that support on the bottom with an orthotic, it'll take the stress off the ligament and decrease inflammation by the heel, and that should reduce your pain. Heel pain is a very common complaint in our practice, and it's very avoidable if you have the proper education and know what to do. So don't put it off, don't ignore it. It's a warning sign that something's happening in your feet, and it's treatable with early intervention.
You'll find information for Tri-County Foot and Ankle when you click the pain-free StoryLink icon online at yourhometownhealth.com.